Our second presenter for this afternoon's session is Michelle Villeneuve from the University of Sydney. Michelle, I have seen present numerous times, and it's always an absolute treat. So I, for one, am very much looking forward to what you have to say today, Michelle. I know there's, again, a significant amount of work in what we're going to talk about today. Michelle will be talking about using peer support to tailor emergency preparedness to the individual support needs of people with disability and emergencies. So please don't forget to use the Q&A, and we'll certainly endeavour to get to those questions at the end. Over to you, Michelle.
Thanks so much, Georgie. I really appreciate that, and I hope I can live up to that introduction. Thanks so much. It looks like the slides are up. I've got to put myself into some kind of presenter view so I can see them. There we go. Thank you again for having me. This presentation addresses the role of peer support in emergency preparedness with people with disability. So I want to walk you through the project that we've been engaged in. Next slide, please. Before we do so, I just want to acknowledge that this project is funded by the Queensland Disaster Resilience Fund and also the Queensland Government, the Department of Communities, Disability Services and Seniors. The project's led by our team at the University of Sydney, but we do it in absolute partnership with the Queenslanders with Disability Network and the Community Services Industry Alliance. And I do want to acknowledge that some of the material that I'm presenting in today's presentation and the tools that we've been using in this project actually come from earlier work that was funded under the Joint State and Commonwealth Natural Disaster Resilience Program, and some tools that we were building when we were working on this project initially in New South Wales. And I also really want to acknowledge all of the peer leaders. I'm going to introduce you to some of them. You'll see lots of pictures of them on the slides today, and hopefully you'll follow us on our continuing journey so that you will get to meet more of them as we progress through this project. Next slide, please. I just want to say that this project is situated in a much larger project, as the slide would indicate, and the action-oriented outcomes in the center of the slide are part of a framework for building disability-inclusive disaster risk reduction in Queensland communities. There's 3 stakeholder groups that are heavily involved in this project: people with disability and their representatives, community and disability support providers, and including healthcare providers as well, and local disaster managers. So that includes emergency service agencies, but also local government involved in the space of disaster management. I'm not going to talk about this whole project, but you can learn more at our website, and I'll provide that information in just a little bit for you. Just a point about DIDRR. What is disability inclusive disaster risk reduction? It's about making sure the needs, voices, and perspectives of people with disability are included in disaster management practices. Everything before, during, and after a disaster. And the issue here is that people with disability have essentially been excluded from the conversation. And this journey that we'll talk about with peer support will show some of the challenges that we've been encountering and ways that we've been trying to overcome them. Next slide, please. This presentation focuses on the action-oriented outcomes focused on people with disability. So we're looking in this project to increase the self-assessment of people with disability to be able to self-assess their own preparedness, their capabilities and support needs and emergencies, to make formal emergency preparedness plans that are tailored to their individual support needs, and that they ultimately optimize their self-reliance and their planned reliance on other people. And I was pleased to hear Alice Hill talk about what is needed. What we need is innovation. And I think what we need is innovative approaches to including people with disability. And that's certainly been called on by the UN Agency for Disaster Risk Reduction. And it's something we're trying to achieve through the work we're doing in Queensland here in Australia. Next slide, please. So I said that it was part of a larger project, and even the peer support components of this project are quite massive. And so the old adage of how do you eat an elephant, one bite at a time, is really important to apply to this project. What you can see on the slide is the methodological approach that we use. So it's representing the knowledge to action cycle. In the knowledge to action cycle, there's 2 things happening simultaneously. And in fact, the arrows maybe belie what's actually happening in the process. The arrows suggest it's going in this nice circular fashion and progressing in a linear way. But in fact, we circle back numerous times as we move around the outside of the circle. I'll describe the outside part of the circle first. This is really all about our program design, understanding what the need is, developing the program design, implementing, monitoring, evaluating it, refining that program and sustaining it. So the outside is the process that I'll be describing as we go through the slides today and give you a flavor of how we developed our peer support capacity development program to enable people with disability to tailor plans to their support needs. But the inside of the diagram is equally important. So we use this knowledge in an iterative way to ask lots of questions, synthesize what our key learnings are, and I'll be sharing some of those key learnings with you today. And ultimately, what we do together with our stakeholders we're working with is develop products or tools that people can use in action. So even the triangle in the center sort of belies the process. We in fact start building those tools and using them before we finish them. And through the process of learning together, we usually are in the process of refining those tools as well. So again, I'll talk about that process in designing our person-centered emergency preparedness workbook today, but also I'll allude to the fact that we actually have some other products that will continue to emerge from this particular program of work over the coming months. Next slide, please. All of the products that we produce are meant to be open access, available, and used by everyone. They're always co-designed and tested in the community. In the case of today's project, developed and tested by people with disability themselves. So I encourage you to follow us and follow the development and the publication of our resources, and feel free to download and use them at our website, collaborating4inclusion.org. Thanks. Next slide. Okay, so what is the issue? Let's zero right in on the issue for people with disabilities. The main problem is that current education awareness campaigns that the emergency services sector targets for disaster preparedness or emergency preparedness, response, and recovery are for the general population, frankly. They're about all the things we all need to do to prepare. So what do you get, or what do people with disability get when they get generic education about things they need to prepare? Well, they get a torch in their emergency kit, and they get extra stockpiling of water, and they make sure they back up important documents for themselves. But that is insufficient for people with disabilities in an emergency situation. Some people with disability will need additional support, additional resources, perhaps advocacy and support from other people in order to prepare effectively, to respond effectively and make good decisions during a disaster, and to recover quickly in the long term. So the planning and preparedness for people with disability really needs to match much more effectively with both their capabilities, what they can do for themselves, and their support needs, what they need support from other people, equipment, or tools to accomplish. Pre-planning will require these three things: self-reliance, planned reliance on others, and addressing gaps through collaboration, advocacy, and essentially through really clear communication. So this project was really focusing on optimizing preparedness through tailored planning to address these particular issues. Thanks. Next slide. We used the Person-Centered Emergency Preparedness Framework. The Person-Centered Emergency Preparedness Framework, or the P-CEP, is a self-assessment process to support people with disability to tailor emergency preparedness plans. You can see that it's divided into 8 elements, and it focuses in having people think about what they do, where they do it, and who they do it with. And that's because emergencies don't wait for us all to be safe at home with all the people who are around to support us. They can actually happen anywhere at any time. And it recognizes that people with disability live lives just like you and I, and can be out in the community or at work or volunteering or in a number of different environments when a disaster does strike. So we need to be prepared for every environment that we're in. We call this, or you might hear me sometimes refer to this as the capability wheel, because it's about what we can do for ourselves. It's about what we need support for. And it's about the opportunities we have and the choices we make to take the resources and convert them into actual actions in an emergency situation. And I know I'm talking to I'm preaching to the converted when I'm saying when we pre-plan for those things, then we'll be able to make more effective actions when the disaster strikes, and when it's more difficult for us to sort of organize our thinking under pressure. Thanks. Next slide. And just as a quick overview of the P-CEP and the value behind it is that it helps, again, to break down the planning process for people with disability. For some people with disability, all 8 of these elements might be really important. When all 8 are important, it's pretty easy to dig your head in the sand and stop planning and preparing. And it requires a lot of motivation to keep going. So the tool itself can help you to prioritize big ticket items and things you need to prioritize and plan for, and helps to break that process down. You can learn more if you'd like about the Person-Centered Emergency Preparedness Toolkit at the website that I showed earlier, but I just wanted to focus you in on the Psep because it was central to the peer support program. Thanks. Next slide. So I'm going to speak about these 3 parts of our methodological process together. I'm going to talk about an existing peer support capacity program that we built on. That peer support program is operated by the Queenslanders with Disability Network. They have 25 peer leaders, and those peer leaders come from communities across Queensland. They have a potential to reach up to about 300 people through regular monthly peer support groups where they bring people with disability together to support each other. Normally, they provide support around everyday issues around disability and inclusion, and in many cases about the National Disability Insurance Scheme and other strategies and other ways that they can support each other. In this case, we were looking to integrate Psep into this existing peer support program. So we needed to develop the capacity of the peer leaders in person-centered emergency preparedness. And then not only have them engage in peer support, but before they could engage in peer support, make sure they had an effective plan themselves. So a big part of our process was looking at how do we develop peer support in the 25 peer leaders? And now, how are they taking these messages about person-centered emergency preparedness and disseminating those strategies out through their own peer support model in practice? So I'm going to share in the rest of the presentation some examples of our learning in action and give you a bit of a flavor of what it's been like over the past few months. Thanks. Next slide. So we started with a peer support capacity development program, or, we were calling it a workshop or a training event. We brought 19 of our peer leaders together at this event. Now, I told you there were 25 across Queensland, but only 19 were available on the day. 6 are unavailable for other reasons: illness, hospitalization, and caring responsibilities. So the 19 of the peer leaders came together over a 2-day event, and the 6 additional peer leaders were trained individually over the month following the training program. Pay attention to the dates. 24th and the 25th of February is when we held this training face-to-face in Brisbane, and we brought these folks together from across Queensland communities. And following the event, they all traveled back to their own home communities across Queensland. I myself was in Brisbane at the time and continued to some of these other communities in Queensland before flying home on March 2nd. And of course, COVID struck, and I haven't been back since. So part of the story does talk about how we adapted perhaps and became resilient in the face of an additional challenge of COVID. Thanks. Next slide. You'll notice in the last slide that there were a lot of people with disability holding the microphone. And on this slide, there's some emergency managers, state level and local council level emergency managers holding the microphone. That was intentional. It was a really important part of the program to make sure that people with disabilities were asking questions of each other, sharing stories with each other, but also getting access to accurate information, tools, and resources about disaster risk management, about preparedness steps, about local hazard risk, about where to access information. And in the process, it was also really important for the 2 groups to dialogue with each other. So an incredible amount of learning happened between people with disability sharing stories, but also between people with disability and the emergency managers who participated in the training event itself. Accurate information was a really critical feature of the program and continues to be a really key driver in the peer support program. One of the things that can happen when you tell stories and support each other through dialogue is that you can potentially you can potentially reinforce some of the same messages within your peer group. We stressed from the outset the critical importance of accessing accurate information from reliable sources in their home communities, and then modeled that in our workshop as well to make sure that when people with disability were introducing hazard risk information information, and introducing people to preparedness steps and resources in their home communities, that they actually reached out and connected in and continued this dialogue with the emergency managers back home. We also, in this part of this conversation, through telling stories with each other and learning from emergency managers, recognized how important it is to be super realistic. For people with disabilities to learn directly from emergency managers what is available to them before, during, and after an emergency, but also what is not available to them, and therefore what are they really going to have to think about and plan for. And a lot of the aha moments happened in that space. Thanks. Next slide. I wanted to also draw your attention to, we were talking in the last presentation about complexity. Well, there's a lot of complexity when you're trying to take 25 people, train them up in a new approach to thinking and working, particularly in a population of people who've never been included in this space before, and then suddenly turn them into leaders where they're going to have the capacity to share this information throughout their community. So we used a transformational leadership approach, and we modeled these 4 behaviors with the community that we were working with, these 25 peer leaders, and we had high expectations that they would exemplify the values of person-centered emergency preparedness when they took these strategies out into their community. Thanks. Next slide. So what follows are some key lessons. Inclusive principles must underpin all capacity development if we want to ensure disability inclusive disaster risk reduction. It's really critical that the co-design happen, and what you'll see on the slides is people who have disabilities, people who have disability and emergency management experience, and people with emergency management experience all coming together to co-design and co-lead the instruction of the program. Thanks. Next slide. A healthy dose of realistic optimism is also important. We conduct an activity at these workshops where we have people respond to a very brief quiz about their level of preparedness, and they physically line up across the room, which in this particular instance with people with all their mobility aids or people who are blind and have their assistance dogs and so on, can take a little while to organize. But we essentially have people line up from never having thought about preparedness before, number one, down at one end of the room, all the way through to having reviewed actions and told others about their plan. And then we take a strategic opportunity to have people look up and down that line, really take a thoughtful reflection on where they stand at that particular moment in terms of their own preparedness, and recognize this main key message that preparedness is a process. You can't be expected, if you're at level 1, to suddenly jump to level 5 tomorrow. You need to take individual steps along the way. And as people look up the line in particular to their neighbors at number 2 or number 3, they realize that they have partners in planning who are a little bit more prepared to that than them, and that they can seek advice and support about what steps they took and how they achieved them. Thanks. Next slide. Another critical thing is the importance of understanding just how overwhelming this is for people with disability. I can't tell you how many times our participants, these very strong, very charismatic peer leaders, have said, this is overwhelming, this is confronting, this is very messy, but at the same time, it needs to be done, and they're stepping up to the action. In fact, Rebecca, who you see on the slide, took the opportunity during this conference while she was staying at her hotel she took a little initiative and told the hotel manager that she was doing some homework. She's on the 14th floor currently at the hotel she's staying at, and she wanted to know what the evacuation plan was for her since she's in a wheelchair. And that ensued a series of conversations, not only between her and the hotel manager and the staff of the hotel, but the following day when she reported back on the findings of her advocacy at the hotel. Thanks. Next slide. We know that it's critically important to have a conversation partner. We know it's overwhelming, confronting, and messy, and the way to get through that is to have someone to share with, someone to talk with, someone to motivate you when it doesn't seem like the most exciting thing you could be doing, creating a person-centered emergency preparedness plan, or choosing from among the number of other activities you could engage in. So conversation partner becomes really critical to this process. Thanks. Next slide. Of course, the real test of an emergency plan is whether it works in an emergency. And our peer leaders, like everyone else, need to know that the effort they're going to put into planning will actually work when it comes through. And I don't know if you've been following the Disability Royal Commission, but Ricky Buchanan has been working with me on developing her own plan. And she had an opportunity to talk to the Disability Royal Commission about the effectiveness of her plan when she did have to put it to the COVID test. And so we actually are featuring some of her case stories and examples in our resources that we're building to help other people with disabilities to see that they can do it too. Thanks. Next slide. It's really critical that your plan's communicated with the people who need to know. So here's an example of one of our peer leaders and how they put their plan together. I love how she represented herself as Superwoman in the wheelchair in the circle in the right middle of the diagram. And she really was empowered to pull out the pieces of the plan that were priorities for her and critical. House fire was something she was quite worried about. Evacuating from her house with her wheelchair and equipment was really critical because she only had one viable exit. She was very concerned because the one viable exit is near the kitchen where she expected most house fires to break out. Communicating the plan in this case went to the two support workers that regularly work with this individual at their home. So they now have a physical copy of the plan. I understand that it's posted to the individual's fridge as well. And everyone who needs to know what all the pieces of the plan are know what to do together if this emergency ever strikes. Thanks. Next slide. We're also learning that there are other facilitators in this process. It needs to be strengths-based and capability focused. We can all look at all the hard parts of planning for anyone, and for someone with additional challenges and needs that they need individualized support for. We need to keep it positive, strengths-based. We need stories and worked out examples. And so we worked really hard to collect, build, and share the stories of other people in various stages of making their plans and package them into what is now the person-centered emergency preparedness workbook. People need resources that can break it down, and the workbook is full of a number of strategies and tools for breaking the process down. And we're learning from our peer leaders that having a leadership role is pretty darn motivating for making your own plan. If you've got to go out and run a peer support group or do some individual mentoring with your peers, then you're certainly going to feel compelled to be more prepared yourself. So it's been quite a positive outcome from the leadership perspective. Thanks. Next slide. And we know it's really important to recognize that there will be gaps. Collaboration is needed to address them. And that goes back to the initial modeling we did and the transformative leadership approach, where we're trying to encourage our peer leaders to connect in with their local emergency managers and connect their peers in with their local emergency managers, start facilitating the kind of dialogue that's going to be critical to unpacking the challenges and addressing them through collaboration and through advocacy. Thanks. Next slide. So here we are now. We're actually in the process of implementing this program through person-centered emergency preparedness peer support in two ways. Next slide. The first way is through peer support groups. I said these 25 people each run peer support groups across Queensland, and they actually started those peer support groups in March, and they started running some of them online. You can learn more about those groups on our Facebook page, and I'll post that at the last slide. Thanks. Next slide. We don't have time to show you this clip, but I wanted to highlight that one of the exciting things that will happen is we'll be producing some videos, both about the planning process of our peer leaders, as well as the peer leadership model and approach from their voice and perspective. And I won't show you the video clip today, but Nadia will be sharing in a future video that we'll share with you her thoughts on both preparedness planning and initiating it through peer support practices. Thanks. Next slide. And the second way that we're engaging our peer leaders and peer support is through individual mentoring. 5 of our peer leaders, we've been calling them super peer leaders, are each going to provide individualized mentoring with 5 people each. The goal is to have 25 people supported through peer support to have individual and tailored plans. And we're pretty excited about the action research process and those 5 super peer leaders working alongside us to examine the implementation of the same process, but with them leading the process instead of us modeling and mentoring it with them. Thanks. Next slide. I did mention that COVID-19 put our training to the test, and our peer leaders acknowledged that it's a game changer and the ultimate test of their shelter-in-place plans. It had some positive advantages to it. It meant that people were needing to develop some online skills and to stay in touch and stay face-to-face, but it also meant that they had a compelling reason to make a plan. Thanks. Next slide. We actually used the opportunity to work on a very COVID-specific P-CEP plan and produce some planning guides, which are also available on the website that I shared. And in fact, it was the COVID-specific planning guide that our peer leaders got started with at the outset. Thanks. Next slide. And here we are at the products and tools. So far, we've produced the COVID-specific planning guide, and we've now produced the person-centered emergency preparedness workbook. Next slide. Here's a poster of it, which you can actually download from our website, alongside both the form fillable or the screen reader enabled PDF versions of this tool. So what I told you that we usually develop these tools and test them as we go, and that's exactly what happened in this project. We had a very clumsy looking draft of this, and now we have a nice polished version with stories and tales, and all of those key lessons that I just shared with you are now embedded in this 50-page planning guide, and we've broken it down to make it less overwhelming into these 4 steps and encouraged our peer leaders to recognize that this is a planning conversation. It's a process that takes place over time, and no one's meant to do this workbook in one go. So we're really excited about the opportunity for our peer leaders to be introducing this with the people they're mentoring. Thanks. Next slide. And the last thing is I'll just draw your attention to all of the resources to help you stay up to date on the project, both our Facebook page, but also our website where you can access those tools readily. And don't hesitate to stay in contact or follow up with me to ask any questions as we go. We'd love increasing participation as we expand this project to other parts of Australia. Thanks.
Thank you so much, Michelle. As always, a wealth of information in that. I would like to draw people's attention to the collaboratingforinclusion.org website, where a whole heap of the material is accessed, and then the links that Michelle's put up there as well, where you can access a great deal of that information. I'd love to hear about the sustainability piece around the train-the-trainer concept. Because of time, we will again move the questions, if we may, to the Knowledge Hub. If there's anything in those questions that Michelle is then happy to answer, we'll do that through the Knowledge Hub after this event. Thank you so much, Michelle, for your time and for the incredible work. I just find it fascinating, and I know that it's not easy work, but it's incredibly important work. So thank you so much for that.